Good morning, MilfordMD, Richard Buckley, and team. This morning's project is gynecomastia. So men have breasts like women. We don't have mammary glands, but we do have glands that can get big. So our patients' glands have gotten big on both sides. Sometimes they happen in puberty, sometimes they happen for no good reason, sometimes they happen because of taking bodybuilding supplements. Probably one of the more common ways that the chest can get big, the gland can get big. Typically, the chest mound is a combination of two things, some fat and also especially the gland. So if you simply take out the fat, leave the gland, then there's still a forward protrusion, which doesn't accomplish achieving the result and the confidence that our patients would like. So while occasionally we can just do liposuction and in a breast that's only fatty on a male chest, then sometimes just the lipo alone will take care of it. Most of the time we need to do a combination of liposuctioning and getting the gland out. You might ask, well, how do we get the gland out? Yeah, there are many different ways. I would say in my experience there's one great way, and the great way is just to make a little zigzaggy incision on the bottom part of the pigmented edge of the areola. So there's the nipple and the areola. It's the nipple-areolar complex. Just a little bit there. And from there I can go in underneath the skin and I can get that gland actually out. If it's a huge gland and we still keep the little incision small, then I take that gland out maybe in a few pieces, which is called morselization if we do this, like eating a morsel of food. But anyway, we'll get that gland out. That gland's about this big around. First, I do, not always, but often like to use Vaser, blast the fat off, and I find that I can reduce the gland size also with this Vaser, which is nice because it makes it a little smaller and hence easier for me to isolate and then get out through the little incision here. The little incision, well, underneath and after the gland's out, and if there's some depressed area because the gland was pushing on it, then I put that back together, giving some lifting of the skin and leveling of the underneath. And then we put some little dissolving stitches in the edge of the areola. Invariably, they have always healed up beautifully, and so they're cosmetically amazing. Our patients always love them, we always love them. And so, having said all of the above, and once I find my switch of my gadget here, which is a cool switch because it's wireless, and so we have two of them, one on each side, they can move around. This makes very high frequency sound. Are you awake?
Yep.
Comfortable?
Yes.
Totally?
Yes.
Yeah. So this thing makes high pitched sounds. You hear that?
Mm-hmm.
Yeah. So I don't hear it that much because it's way down in there. But since it's in there, our patient can hear it pretty well. So, gynecomastia surgery, technically it's a bilateral nipple-sparing mastectomy. That's what it is. Maybe I'll bring you back later and show you something else. Note how things are poofed up now, and this gland is this big in the center. You can see how much I can pinch. When I'm done, I'm not going to be able to do that. It's going to be nice. Okay? Bring you back later. By the way, reminder, a week from this Thursday, so today is the 12th of May, 2026, it's Tuesday. So Thursday, May 21st, we have an evening seminar all about facial rejuvenation, collagen banking, biohacking, different kinds of facelifts, lots of before and after pictures, raffles, etc. Definitely give a call to the office, 572-964-4000, and let the staff know you're coming. We will love to see you, and you'll have fun, learn some things, have some opportunities to even save some money for things that you love, including a raffle of some Sculptra, which PLLA, polyolactic acid, as well as a facial filler. So call us, get a date, and again, maybe I'll bring you back a little later to show you more of this action here. I'm blasting the fat cells off with Vaser right now. Thank you for watching another episode of Girls Say It.
MilfordMD.
MilfordMD. Thank you.